Hi, my name is Deanna Salter, student nurse, and I'm going to demonstrate how to do internal tube feeding. You need to get your supplies. You're going to need your kangaroo bags, your tube, and whatever feeding you're going to be using. You check that by checking your doctor's orders and making sure everything is correct. You check for allergies, and you're going to check the patient's IV band when you go in the room. So you're going to enter the room, you're going to wash your hands, don your gloves. I'm going to ask the patient their name and date of birth while looking at the orders to make sure we're in the right room. I'm going to look at my materials and my supplies to make sure we have the right supply. I'm going to shake it up. I'm going to position my patient in high fallers. And then you're going to put your Jevity or whatever feeding you're using into your bags. You're going to use one bag. These are kangaroo bags. So one bag is for your feeding and one bag is for your water. You're going to fill it all up. Make sure you're writing the patient's name and room number and the date and your initials on the bag to know that you have changed it and what day it's been. So you're going to go in. You're going to verify your placement of your tube. You make sure you use a stethoscope, and you're going to check for residuals. You get your tube. You're going to pull back and see how much residuals you have. If you have more than 250 or 300, depending on your orders, you may have to call your doctor or stop the tube feeding altogether and document and notify the physician. So then you're going to go ahead and flush your tube with 30 mLs of water. You're going to go ahead and attach the feeding tube into the NG tube. You're going to turn it on. And you're going to make sure you have your settings to whatever your orders is on your mark. You're going to go use gravity for the bolus feeding. So you're going to enter it and then put in 30 mLs when you're complete. If you're using continuous feeding, you're going to go ahead and flush it with 30 mLs and every 4 hours, and then go ahead and continue your feedings and make sure you're changing your tubing and everything every 24 hours. You're checking your residuals every 4 to 6 hours, depends on what your orders say. The feeding bag and everything should be hanging up top along with your tube and making sure that the date and the patient's room number is there. You're going to make sure that you're checking to make sure the patient hasn't vomited, has no vomiting. You're going to document your residues, your appearance of your patient. You're going to look at the site of the PEG tube to make sure everything gets clear, no drainage or anything like that. You're recording your input and output. And you're going to make sure you're cleaning the site daily and the tubing daily. After that, you wash your hands. You can take off your gloves and like I said, make sure you're documenting at the end. Thank you.